members, welcome back today on DDM House News Update. Under our program, Your Health, Your Wealth. As a reminder, as usual, I often remind you guys, if this is your first time joining DDM House News Update, please do ensure to click on the subscription button. Subscribe to our YouTube channel, Diaspora Digital Media, because we'll give you the latest on health. Always remember, your health is your wealth. Well, what do we have today? Medical doctors under the aegis of the National Association of Government General Medical and Dental Practitioners, that is NAG-MDP, Federal Capital Territory Branch, have raised the alarm over an impending collapse of healthcare delivery across the 6 area councils of the FCT if urgent steps are not taken to address lingering welfare and infrastructural issues. That'll be small thing though. The doctors, in a statement issued on Tuesday and signed by the branch chairman, Dr. Okorafia Obunnaya, warned that the current situation, if left unsolved, could spiral into a full-blown healthcare crisis, affecting thousands of residents in Abuja's satellite community. Please, we don't want to lose life. Really. Doctors demand immediate action. Please, government, try to do something about this. According to this association, key demands include the immediate implementation of the approved national minimum wage, improved working conditions, better healthcare infrastructure, and the settlement of all outstanding entitlements of health workers within the area councils. These are the things the doctors require. And please, the government should work towards it. Our members working in the health department of the 6 area councils have been subjected to persistent neglect, the statement reads in part. These are the complaints they brings about. Despite the approval of a revised national minimum wage of 70,000 naira by President Bola Tinubu in July 2024, our members are yet to receive its implementation, a clear violation of their rights and a disservice to those at the front line of healthcare delivery. You can imagine, since 2024. The association lamented that the neglect is not limited to salary issues, but extends to promotion delays, lack of essential medical tools, poor facility maintenance, and non-remittance of pensions and bonuses, among others. You can imagine things that doctors lack. How would they work with joy? NAG-MPD highlighted the deplorable state of primary healthcare facilities across the area councils, describing many of them as dilapidated and unfit for service delivery. Doctors and other health workers operate under unsafe and unsanitary conditions. That was what it stated. Facilities lack basic equipment, drugs, and manpower, exposing both patients and workers to grave risks. You see what I'm talking about? Patients die early because of lack of drugs and medical equipment. The group expressed worry that the ongoing industrial action by health workers in the area councils could sabotage the bold efforts of the FCT minister, Yeltsin Wike, especially in tackling maternal and infant mortality. How will it feel that our child are dying, our mothers are dying? We commend the Honorable Minister for his commitment to finding lasting solutions to this crisis. However, the inaction of the area council chairman continues to undermine these efforts. The association complained. These are the things they complained of. NAG-NDP warned that if its demands are not met within the next 2 weeks, it would convene an emergency state executive committee meeting to determine further action, which could include escalating the strike to affect secondary and tertiary healthcare services in the FCT. No be small thing, no. This one no be joke. Well, among its demands includes immediate implementation of the 70,000 minimum wage that was promised by the president since 2024. Secondly, urgent improvement of working conditions, comprehensive rehabilitation of health facilities, prompt payment of all outstanding entitlements. These are the things they are in need of. These are their rights, rather. These are their rights, their needs. Structured dialogue with stakeholders to resolve this crisis. Effort to reach the chairman of the FCT branch of the Association of Local Governments of Nigeria, that is the ALGON, and the chairman of Kwali Area Council, Mr. Chia Danladi, for comments proved repulsive, as calls to his mobile line were unanswered. Text and WhatsApp messages also yielded no response as of press time. You can imagine that. If you are in the doctor's shoe, tell me, will you continue to work as a doctor? Me I go resign, no. The association called on all relevant authorities, particularly the 6 area council chairmen, to act swiftly in the interest of public health and industrial harmony. Please, they should do that as quick as possible. NAG NDP FCT remains committed to dialogue, but failure to address these issues may lead to a total shutdown of healthcare services in the FCT, the statement concluded. How will it see it that the Federal Capital Territory of Nigeria has no medical practitioners? My dear, check it out now. It doesn't make any sense at all. Well, up next, in a bold move to strengthen healthcare delivery and promote clean energy solutions, the federal government has commissioned the first phase of a 400 kilowatt solar photovoltaic power plant at the Yobe State University Teaching Hospital, Damaturu. Wow, this is lovely. Speaking at the commissioning ceremony, Minister of Power, Chief Adebayo Adelebu, who was represented by the ministry's permanent secretary, Mr. Mamadou Mamman, described the project as a significant step in advancing President Bola Ahmed Tinubu's renewed hope agenda, especially in the power sector. Wow. This project speaks directly to our commitment to make energy access a fundamental right, not a luxury, Adelabu said. With these solar plants, we are reinforcing the administration's drive to ensure uninterrupted and clean power supply to critical facilities like hospitals. This is really, really wonderful. Yes, I applaud again. According to the minister, the solar initiative is designed to power essential hospital services, including surgical operations, refrigeration of vaccines, and the running of advanced medical equipment, thus eliminating reliance on erratic grid power or expensive diesel generators. Wow. Aww. Adelabo added that the initiative aligns with the provisions of the Electricity Act 2023, which prioritize renewable and decentralized energy sources, especially for rural and undeserved communities. He further noted that incentives like feed-in tariffs would help accelerate private sector investment in clean energy. You can imagine, you come to hospital now, solar day there. This project marks the first phase of a larger vision. One target is to scale this facility number 1 megawatts and replicate similar interventions nationwide in schools, hospitals, and other public institutions. He added, I'm seeing the action because they say action speaks louder. The Yobe State Governor, Maya Malabuni, represented by his deputy, Honorable Idi Bade Gubana, lauded the federal government intervention, describing it as timely and impactful. Very, very impactful. These power plants will drastically reduce the hospital's operational costs and enhance service delivery, Buni said. I agree with him. With the hospital's capacity expanding from 250 to 750 beds, uninterrupted power is no longer a luxury, but a necessity. Of course. Governor Budi also highlighted other key healthcare reforms in the state, including the establishment of the Yobe State Contributory Healthcare Management Agency and the upgrading of 9 health centers to general hospitals. Wow! From health centers to general hospital. Yobe, you guys are trying, honestly speaking. Also speaking, the Commissioner for Health, Dr. Muhammad Ghana, said the solar project would particularly benefit the Senator Maman Ali Maternal and Child Health Complex. Which is equipped with cutting edge technologies such as MRI scanners and 3D ultrasound machines. Wonderful. This intervention showcases a seamless collaboration between state and federal efforts to uplift public health infrastructure in Yobe and beyond, Ghana noted. Wonderful. Yobe State, you guys are benefiting a lot too. With the successful takeoff of these renewable energy projects, the Damaturu facility is expected to become a model for future power solutions in Nigeria's healthcare sector. This is really wonderful. I applaud. I keep on applauding to the Yobe government and its collaborative facilities. Finally, as heavy rains begins to pour across West Africa, bringing with them a surge of malaria-carrying mosquitoes, communities in Nigeria are bracing for a health crisis of alarming proportions. Malaria. God help us. In Borno State, where insurgency and poverty have already battered public health, the situation has taken a grim turn. This one is sad news. Health centers once bustling with hundreds of patients daily have now gone silent, the result of a major withdrawal of US foreign aid. So sad. Musa Adamu Ibrahim, a trained nurse, now sits idle at home in Maiduguri. Like many other healthcare workers, he was laid off following the abrupt discontinuation of US aid programs, a decision attributed to a policy shift under US President Donald Trump. The clinics have been closed and there are no more free drugs or mosquito nets. These are the words Ibrahim told newsmen. It's heartbreaking to watch people suffer without any help in sight. Please, the Bono government should come to the aid of these people. Nigeria accounts for about 30% of the 600,000 global malaria deaths annually. You can imagine that. Yet, the resident aid cults threaten to undo years of progress in the fight against malaria and other preventable disease. We know that malaria is the major sickness in Nigeria. Health professionals and development experts say the collapse of US aid-funded health interventions has left gaping holes in the country's already fragile healthcare system. You can imagine that. Some people are no longer employed. They sit idle at home. The effects are not limited to Nigeria alone. In Mali, drug supply chains have stalled, leaving essential medication warehoused without proper distribution. In South Sudan also, 5 children reportedly died while trekking to the nearest cholera treatment center after US aid-funded clinics closed. So sad. Kenya's Kukuma refugee camp, home to over 300,000 displaced persons, has experienced medicine shortage and public protest over ration cuts. So sad. Dr. Lawrence Barrett, a former advisor with the US President's Malaria Initiative, said the impact would be most felt by the poorest of the poor. You can imagine that. How are they going to survive? Those in remote areas with no means to seek private care, their children will pay the highest price, he said. God. As the rains advance, Nigerians have started. While Senegal's are expected by May, African countries are facing a new challenge. How to manage the malaria peak season without a major donor? How are they going to survive? It's so sad. Fatima Kunduli, another lady of health worker in Bonu, revealed that her clinic used to attend to at least 60 children daily for malaria and malnutrition before it shut down. From 60. Experts say this sudden exit of US aid has left ministries of health across the continent scrambling to revise their malaria preparedness plan. In the Democratic Republic of Congo, for instance, US aid was the main supplier of malaria drugs and testing kits to the 9 provinces. Now, patients and doctors alike are left in limbo. How will people survive? In some places, it's like the lights have gone off. Gosh, how will people survive in this area, especially this rainy season? Adding to the growing concerns, there are fresh indicators that Washington may further reduce its contribution to Gavi. That is the Global Vaccine Alliance responsible for supplying vaccines to developing countries. This is not going to be an easy fight at all. Many people will lose their life this year. This is too big, a hole to be filled, Gavi CEO Sania Nisha lamented. Health professionals fear this could lead to a resurgence of vaccine-preventable disease, such as measles, polio, and yellow fever. And these are the diseases reigning this time around. At Kinkole General Hospital in Kinshasa, 23 mpox patients are currently being treated in isolation tents, a service sustained by American funding. However, hospital staff worry that without continued support, they may be forced to close their doors too. Oh my goodness. How? We are thinking a disaster is coming, warned Yvonne Wallo, an epidemiologist at the facility. Back in Bonu, where the threat of Boko Haram insurgency remains palpable, the loss of foreign aid has compounded an already dire situation. Not be Boko Haram that they talk about this time around. This time around is the health. Fatima Kunduli, reflecting on her time at the clinic, said the work was exhausting, even with full support. How is it now going to be? Now I can only imagine the suffering that is coming. I can imagine. With rains falling, malaria surging, and vital health services cut off, the most vulnerable, women, children, the elderly, are once again left to face the brunt of a crisis not of their making. How will they survive? Well, it's really a pity. I just pray the governor comes to the aid of these young people, especially the mother and the children, even the elderly. Everyone are involved. Well, viewers, with this, we come to the end of today's program on your health, your wealth. Please do ensure to click on the like button, share, comment, and subscribe to our YouTube channel, Damaturu Digital Media. I remain your host, Nenyo Michaeline Ezini. Thanks for watching. See you next time. Bye for now.